Osteopetrosis is an interesting disease. With osteopetrosis, the problem is going to be due to a mutation in carbonic anhydrase 2 enzyme. So, when we have a mutation in carbonic anhydrase 2 enzyme, osteoclasts are not going to be able to generate the acidic environment that they need in order to resorb bone. So, what is going to happen with this disease is that because osteoblasts are going to be overactive compared to osteoclasts, we're going to be just haphazardly building bone. And this is what osteoblasts do. They like to create bone quick and fast. And we need osteoclasts to kind of define this bone so that it is strong. So because of more osteoblast activity compared to osteoclasts, we're going to haphazardly form a dense bone that is going to be fragile. So as a result, patients with osteopetrosis are going to be at a higher risk of getting fractures. Now, the way I like to think about the symptoms with osteopetrosis is going to be with the mnemonic PET. So P is going to stand for pancytopenia, which is something that patients with osteopetrosis can get. Pancytopenia refers to low red blood cell levels, white blood cell levels, and platelets. So remember that bone marrow is going to be making these cells. And because the dense bone is going to move into the bone marrow area, it is going to disrupt the bone marrow. And so that is going to cause pancytopenia. And because now we can't make these cells in our bone marrow, we can get extramedullary hematopoiesis, which is the formation of cells outside the bone marrow. We can also get an Erlenmeyer flask bones, which is going to be a radiological finding in patients with osteopetrosis. And you can remember the T for tubular acidosis, which can also remind you of carbonic anhydrase 2 deficiency. If you remember from the proximal comminuted tubule in the kidney, carbonic anhydrase isn't going to be an enzyme that is going to ultimately produce bicarb, and we're going to reabsorb bicarb in order to make our body more basic. So if you have a deficiency in carbonic anhydrase, then we're going to be absorbing less bicarb, and so that is going to acidify our body. So as a result, that can cause tubular acidosis. Because the skull is going to thicken, we can get nerve impingement, which can lead to visual and hearing disturbances. We can also get hydrocephalus due to narrowing of the foramen magnum because of the thickened skull. So that is over here. So here are all the clinical features of osteopetrosis. We've covered all of these. Um, also, patients are going to be benefiting from a bone marrow transplant. And just like osteoporosis, there's not going to be any changes in serum phosphate, calcium, alk phos, or PTH, which is parathyroid hormone.